Heart failure explained simply for nursing students. This lecture is optimized for NCLEX and DHA exams. Heart failure is a clinical condition in which the heart is unable to pump enough blood to meet the body's needs. Heart failure does not mean cardiac arrest. In heart failure, cardiac output decreases and fluid retention increases, leading to congestion in the lungs and body. Heart failure is mainly classified into left-sided and right-sided heart failure. Left-sided heart failure occurs when the left ventricle fails to pump blood effectively, causing blood to back up into the lungs. Common symptoms of left-side heart failure include shortness of breath, orthopnea, crackles on auscultation, and pink frothy sputum. Right-sided heart failure occurs when the right ventricle fails, causing blood to back up into the systemic circulation. Symptoms of right-side heart failure include peripheral edema, ascites, jugular vein distension, and weight gain. The most common cause of heart failure is long-standing hypertension, followed by coronary artery disease and myocardial infarction. Heart failure is diagnosed by echocardiography measures ejection fraction. BNP levels are elevated in heart failure. Chest X-ray shows pulmonary congestion. Medications used to treat heart failure are diuretics relieve symptoms by reducing fluid. ACE inhibitors and beta blockers improve long-term survival. Subscribe to Nursing MedIQ lectures for more NCLEX and DHA focused nursing content.